who, like me, have no idea what day it is half the time. I hope that you're all doing well and staying healthy. Looking forward to talking about a lot of things during this update here this week. First, we're going to start out with our friend Matt Gross from DHHS, as Fawn mentioned, and then we're going to get a federal update and talk about some things that have happened federally and some other things that are in the works around the possible next coronavirus stimulus bill. And then Fawn and our lobbyist, Ashley Perkins, are also going to be sharing information about what's happening at the state level legislatively. And last but not least, we want to get your input on, how you feel like these calls are going. What are things that you feel like would be helpful to help make them better, et cetera, because we really want to be getting your feedback and talking about things that are meaningful to you. So first and foremost, let's move forward with Matt Gross. Matt, take it away.
Hey there, thanks for having me again. So I'll jump right in. I know there's several topics folks are interested in hearing about. First one being childcare, so a quick childcare update. About 56% of childcare providers are currently open. The hotline for childcare is still available, and that is 1-888-600-1685. Again, that's 600-1865. Sorry, I'm tripping. When you say every day feels the same, every day is the world's longest Tuesday. 1-888-600-1685. So far that line's received about 3,300 calls, connected to 1,600 families with referrals for 2,300 children. We have this emergency child care subsidy program that's available to all essential workers whose income is below 300% of the federal poverty line. I believe for a family of 4, that's around $78,000 per year. Approximately 9,800 children have enrolled in that program just since the beginning of April. We also started providing those bonus payments to teachers and staff. It's an extra $300 a month for teachers and $200 a month for staff. And that's for the months of April and for May. And currently, child care programs, open and closed, are continuing to receive their subsidy payments for April and May, and NC pre-K payments for April will be paid for the rest of the year. I know some folks have wondered, well, why is that? And really the goal is to try to stabilize the childcare industry as best we can. We know that that's going to be critical when we look at slowly reopening the state. If we don't have childcare available for folks who can't go back to work, and the profit margins for childcare centers are so thin to begin with, we know that just pulling that money out from under them right now is going to make it even harder. So that's an early childhood update. Another area where I've had several questions is in the food space, which is certainly a big area for concern. I know there's a lot of angles to food space. As far as food waivers go, so one thing that we started, we allowed everybody who receives SNAP benefits to get to the maximum allowable benefit. Currently, that's going to almost 500,000 households, 413,000 households, serving 850,000 individuals. That work is continuing. Another area that there's been questions about, there's a waiver available to allow meals to be delivered to folks. So we've applied for that waiver, anticipating it will get approved any moment, maybe even as early as today. Currently, and that program was piloted originally with Amazon and Walmart. And I think they're able to already do food delivery services for folks who are on SNAP. Once we get it up and running, other retailers can take advantage of them. My understanding is it's a somewhat laborious process to get signed into that program because there's a lot of security pieces you have to have in place, but we have worked on that. Hopefully have an announcement on that very, very shortly that'll be up and running. Another big area of focus just remains not only access to food from a money and supply standpoint, but it's how the food chain is working. We've stood up an entire internal food task force that's looking at things from supply chain challenges to how we're getting meals to people out in the community. So that's a big body of work that's continuing to get scaled up. I think you'll see some things some items in the budget proposal that the governor will be putting forward, I believe sometime next week, specifically focused on meals for kids that are being fed through the school feeding sites. And another big topic that's come up this week, well, really for several weeks and frankly years, are health disparities, but we're seeing as we have more data how those health disparities are really playing out around COVID-19. So, we are one of the few states that's been putting out disaggregated data based on race and ethnicity. And I'll say that data is a little hard to get. I know one of the questions I frequently get asked is, well, it's great we have this, but there's still a lot of cases where that's missing. So just for a little bit of weedy background information, the way we get this data is the labs that run the tests send it directly to the local public health departments who give the testing information to us. Those test results that the labs send to the local public health departments do not have race and ethnicity data or a lot of other demographic information. So the local public health departments have to actually track down and call each individual person to get that data, to get it entered into the system. It's a very time-intensive process, often takes up to 12 hours per person for contact tracing. So it's a top priority to get the rest of that data picture, but it's going to be a slow trickle because, frankly, the cases are coming in faster than all the calls can be made to get that information. That being said, what it's showing us is, tragically and sadly, probably not unexpectedly, we're seeing a more than representative portion of particularly the African-American community both contract COVID-19 and have severe cases with COVID-19. We think there's a lot of factors that are playing into that, and probably ones that folks on this call are familiar with. You're going to have people in housing situations where it's harder to social distance, more apt to be in jobs that are hourly and require interaction, retail and things like that, retail, childcare, food service, food supply. We know that often folks have been, struggled with the systemic racism leads to so many of the underlying health conditions that we know make worse outcomes for COVID-19. It really shines a light on all of the work so many of us have been doing for really decades now. It shines a light on the importance of the healthy opportunities work we're trying to do through Medicaid. Of course, it shines a light on the critical need to do Medicaid expansion. But it's led to some questions of, okay, those are long-term solutions. What can we do right now? And fortunately, the answers for right now, there's not a lot due to lack of resources. I mean, ideally, would we love to make sure that every single person that's in an at-risk community and an at-risk job had access to PPE, which is personal protective equipment? Absolutely. But there's a global shortage, and we put out over $125 million worth of bids for PPE. Most of that hasn't come in, so we're barely able to even keep the hospitals and nursing homes and some of those really critical settings where we have a very large vulnerable population stocked with PPE. So that's a shortage there. Another question is testing, and we absolutely want to keep scaling up testing. But again, there's still a shortage of both the PPE to do the testing and then the testing supplies as a whole. So people can still get tests. We don't have the resources to go out and deploy widespread community testing. I know one test that people have been interested in is the Abbott rapid test, which got a lot of attention. It's a little more mobile, still has to be done in a lab setting, but it can get you results within 15 minutes. The challenge is the federal government controls that entire supply line from Abbott. We got 15 machines as a state and enough tests to run approximately 8 people per machine, and then we're out. And the Fed said they will get us more tests. We don't know when. They haven't given us a timeline. So, that's a tool that will help with expanding testing. In reality, we don't have enough supplies to have that make a big dent right now. Another area where there's a lot of interest in the testing front is doing like serology or antibody testing. The technology in that space is getting better, but there's still a lot of accuracy challenges with those tests. So we're not there yet, but I say stay tuned on that front. So in light of all that, the question comes back to, well, what can we do for, our communities of color where we're seeing this hit harder? And really the answer is it goes back to social distancing as best you can and taking proper health precautions. We've certainly done work with trying to reach out to minority populations, working through churches and other groups like that, but it's an area that we're really trying to beef up because we recognize the efforts haven't been effective enough. So Dr. Michelle Laws is spearheading an even more proactive campaign on that front, trying to make sure we're getting PSAs onto more radio stations that people of color are listening to, trying to do some PSAs with doctors from the African-American community, so they're hearing the message from folks who look like people in the community, and being even more proactive, trying to work with some PSAs with folks in the faith community that can be shared before online services and things. So we're just really working to get the message out, because sadly, in light of all of the supply shortages, that is the one tool that we still have at our disposal right now. The last thing I'll touch on, and I'm happy to see what questions folks have, is Medicaid expansion. So there's been a lot of questions about this upcoming session and what's going to happen, and will Medicaid expansion play a role in it? So one thing that we have put forward, and Speaker Moore actually touched on this yesterday and voiced his support, which I think is encouraging. Though I'll say he also expressed his support for House Bill 655, and that never made it to a floor vote. So I appreciate the support. I'm not taking it to the bank just yet. But we have proposed in our 1115 waiver expanding Medicaid access up to 200% of federal poverty for people who have been impacted by COVID-19 for both testing and treatment. Speaker Moore expressed support for this proposal. It would clearly be time limited in who it can serve. It would draw down the traditional match, the 2/3, 1/3 match. It doesn't qualify for the 90% because of how narrow the focus is. We also have not yet gotten that waiver approved by the feds, but it is in our plan, and I'm glad that Speaker Moore spoke in favor of it. As far as broader Medicaid expansion push, I don't anticipate one at this time in the session that will be happening in just a couple weeks. There's really been a hope for this session that it would mirror what we saw with a lot of the hurricane sessions, and that legislative and executive branches could work together on a comprehensive package that can sail through really quickly and get relief to people, and not get in battle with some of the bigger political fights at this exact moment. The House has been certainly working really closely with us on that front. The Senate, I felt like but they've gotten a little more, I'll say, distant this week with their approach. So I hope that remains the case. That being said, Medicaid expansion is still an absolute top priority, and one that I think as we look towards the session that's likely going to happen in July, we want to make front and center. I don't see how North Carolina's economy can properly recover without Medicaid expansion. We're looking at a healthcare industry that has just been crippled with incredible need, with reduced revenue. How we can't possibly leave another $4 billion sitting on the table that we can bring into this state. And frankly, that frees up other resources to provide supports to other critical small businesses that are struggling in North Carolina. Also, we know there's a much higher uninsured population now as folks have lost employment. And a lot of those folks, as they try to get back to work, might not have full-time employment opportunities that come with health insurance. So it's going to be more critical than ever to have access to Medicaid to fill that coverage gap. So it is going to be a huge priority going forward, even though I don't, at this moment, anticipate seeing it in a package this session, because the session will focus on a more immediate work that can get done really quickly and move on. But it is on the front burner. I think engaging with the business community is going to be really, really key. I know we always say that, but they're the ones looking for this recovery and this help to get the economy up and running again. And they need to understand that Medicaid expansion has to be a key part of that move to reopen North Carolina's economy and get us back in the right place. So any work that folks can do with businesses, helping them understand why that's a key factor they're going to need to not only free up resources for their own financial bailouts, but also provide a workforce that can be healthy, be insured, and come back to work. It's going to be absolutely essential. And so I think we need to really be building on that messaging as we head towards July. And that being said, I think my 15 minutes are up, but I'm happy to stop and see if there's any questions.
We do have some questions coming in the chat box for you, Matt. And folks, if you have questions for Matt, just go ahead and type them into the chat. The first one I see is from Foster Village. They have two questions for you. One, there's concern for foster families who still have ordered in-person visits with biological parents and home visits with social workers. How can we protect families and prevent disruptions? Can there be statewide policy? Seems like each county is kind of doing their own thing and going back and forth. So I think that's the first question.
Okay, let me check. I feel like we have put out some statewide guidance on that. I can circle up with our social services folks to see how that has been adapted with the counties. It may be that we need to push that a little bit harder. You know, it again kind of falls back to some of these other tools we have where social distancing is really, really key. You know, trying to make sure you're creating settings where children don't lose that touch with their biological parents, but you're also mitigating risk. Let me circle back with our child welfare folks to see what guidance is out there, and if we need to do sounds like we need to maybe do a better job at making sure the counties are using that guidance. So thank you for flagging that.
Great. Second part from Foster Village, has there been any thought to giving the full daily stipend to kinship families, so the non-licensed relative caregivers for kids who are in foster care?
It's a good question. I don't know the answer to that offhand. I'll tell you one thing that we were looking at, and this, as we head into this upcoming session, so the governor's budget proposal, which I anticipate will come out sometime next week, we're really trying to frame it as big buckets of work, because we understand, I mean, I think part of the reason this is felt like such a long epidemic that we're really only in the 39th day of our operations is the days feel like weeks, and that's because the situation changes so rapidly. So we're looking for broad buckets of work that can then provide us flexibility to get to the outcomes. So I think probably the easiest way to think about that's in the testing space, where we know we need to increase testing, but don't want to get tied to a specific type of test because the technology is changing. Again, in this space, we're looking for big buckets of money to be able to address these kinds of needs. So I don't think that's been done yet, but I think it would fit in one of the buckets of work that we're trying to put forward to the General Assembly.
Great. And just some confirmation on what we heard from Foster Village. We have another comment from Chrissy Smith saying, as an attorney, she's also seeing the impacts of this inconsistent approach from counties on virtual visits versus in person. So some confirmation of that challenge there. A question from Philip Belcher regarding the food and nutrition stuff you were mentioning, Matt. Are you all coordinating with Feeding Carolinas and other groups who are focused on distributing food?
I know there's certainly a big push to tie in with the food banks and other nonprofits. One of the things, and I know the Alliance for Health has reached out to us as well about coordinating with their partners. That is a piece of the work. I don't have eyes into the details of that one because, frankly, there's just too much to have eyes into. But I know that we're working with partners and food banks and groups like that to make sure we're coordinating the efforts as much as possible. I'd say if folks that are on this call know of partners that want to get involved in the food work and feel like they haven't been plugged in enough, please get that information to me so I can alert the right folks, because I know they're working with so many people. I don't have a comprehensive list, but that doesn't mean there aren't more that we should be coordinating with. So happy to take any feedback of partners that we're not engaging with that we need to make sure are being plugged into the efforts.
That's great. And I don't see any more questions for Matt coming into the chat box, but just on what you just said, Matt, for folks who want to get information to you, they can just reply to the emails that NC Child is sending out about these calls, and we'll forward information directly to Matt. If y'all don't have his contact information directly, we can help facilitate that, sharing that kind of information. So I don't see any other questions coming into the chat box, Adam, so I'm going to hand that back to you.
Great, thank you.
Thanks so much, Matt. We really appreciate it. And it's great to get, finger on the pulse of what's happening so immediately, but then also thinking through the summer and looking ahead around these crucial issues to really get North Carolina back on its feet. So thanks so much. Next, we have Miss Whitney Tucker, who is our acting policy director at NC Child, and she is going to talk to us some about what is going on federally. Whitney.
Thanks for that intro, Adam. So a lot is going on, guys. I'm going to quickly give an overview of that federal level work and then also move into NC Child's priorities in response to what's going on at the federal level so that you guys are aware of that and so you can give us some feedback so that we can really know if we're headed in the right direction. So to start us off, Congress was originally going to return to DC next week on the 20th, but they have extended their recess until May 4th. That said, a lot is in play as they work from home. Negotiations have stalled for what's been called the C-3.5 bill, so that smaller coronavirus response bill that we were hearing was in the works, that would particularly be infusing additional funds to the Small Business Administration to replenish the payroll protection program that was authorized in the CARES Act, another coronavirus stimulus bill. That program had about $349 billion that was allocated to it, and it's already run dry with businesses that have had to apply for those loans. So Republicans wanted to include only additional funding for the payroll protection program into this 3.5 bill, and Democrats wanted to see that as well as an increase in SNAP benefits, some more money for states and localities, and more money for hospitals and healthcare in the bill. And it seems to have just kind of fallen apart on that short timeline. But this little additional time in recess also means that all confirmations are pretty much being stalled because a single senator can prevent them from getting the unanimous consent that they would need to move those forward without returning the session. So those things are both, paused. But in the meantime, there is widespread bipartisan recognition that there's going to need to be some other coronavirus response bill that's bigger than the mere $250 billion that was being considered for a 3.5 bill. And so this next larger bill, which is being called C4, is being negotiated right now. And congressional staff continue to work as advocates like us are really just flooding them with requests for this fourth package. NC Child is finalizing our C4 asks right now. And as I said, I'm going to go through those in a second and so that you guys can see if they adequately reflect your need. There are a lot of things that different advocacy groups have put forward at this point, and we were just trying to identify a few top priorities. Now, all of that said, despite the attention that's been given to coronavirus legislation, Speaker Pelosi is also trying to move the normal budget process forward. So now is a good time to start contacting your legislators to ask them for funding for programs like childcare and after school care, WIC, Head Start, all of that. They are going to be responsive at this point. And in addition to the issues that are directly affecting children that advocates want to see funded through either the normal budget process or through the C4 bill, there have also been some new issues that have popped up and really taken over the public discourse because they do have impacts on children, but that they are larger social issues that have been kind of falling through the cracks in this coronavirus response. So for example, post office funding has become a really big issue, and some of your organizations might want to call legislators about that at the federal level. The post office is going to be insolvent soon, and that is going to have a major impact on those that we know are low income, because that's largely how a lot of people pay their bills, right? So that's problematic. It's also how they receive benefits for some people. So a big deal. There's also a big push to expand access to free broadband, which is really relevant in our state because we do have such a large digital divide. And now that schools have gone completely virtual, it's going to really impact kids' learning. And over time, we're going to expect to see that that's going to show up in some of our reading and math outcome scores. Also, very near and dear to my heart, an extension of the 2020 census is in the works. The Census Bureau has already requested one, but it would require a statutory change that Congress could approve for them. Right now, it's just looking like with everyone in their homes and it not really being safe to go to people's homes because of the spread of COVID-19, that the Census Bureau would really like to push back the census operations and allow a longer period of time for people to answer the census, even online or by the phone or by mail inside of their own homes, because a lot of people just are not focused on that right now. But it has really significant impacts for our funding over the next decade, and also for things like congressional representation and our planning for roads and bridges and grocery stores and schools and all of that. One other major issue that does directly impact children and is being targeted by some governors and members of Congress right now is the maintenance of effort, or MOE provision, that was included in the second coronavirus response bill, the Families First Coronavirus Response Act, and that specifically was related to Medicaid. So some policymakers want to strip that MOE provision from future relief packages, which would really have a disastrous impact on children's well-being. And we can get more into that as I transition into NC Child's priorities for the C4 bill. But that MOE is essentially what is keeping a lot of states from taking funds that would otherwise be allocated for Medicaid payments and using them for, any other things that they wanted to spend money on at the state level, and restricting access to the program. Adam, is this a good time to go into our C4 priorities, or do we want to double back to that?
I'd say let's go ahead and go through those quickly, and then we can move on to the state after that. Yeah.
Perfect. Thank you, Fawn, for pulling that up. So starting off, I wanted to start with the MOE just so we can kind of level set. This is a top priority for NC Child because it is so integral to ensuring access to affordable health insurance coverage. The Families First Coronavirus Response Act did a lot to ensure that people who are already on Medicaid were going to be able to stay on Medicaid. And if we want that to continue to be the case, or to even expand access to the program, if we take out the MOE provision, it's going to make it a lot easier for states to enact things like freezes and cuts and caps on income and all kinds of different provisions that could change from state to state to suppress Medicaid enrollment and free up funds that would go to that program for other state priorities. And we know that obviously in the middle of a pandemic, that could have really disastrous impacts on everything else in our society, because folks on Medicaid are some of our most vulnerable when it comes to income and their ability to stay away from other people during this period of social distancing. A lot of them are already on the front lines, right? In addition to that, Fawn, can we get next slide? We, to strengthen the healthcare program, want to see an increase in the FMAP. So the FMAP is the Federal Medical Assistance Percentage, and it determines essentially what portion of Medicaid and also foster care costs the federal government will pay to ease the burden on states and allow for some cost sharing. So right now, there has been an increase in the FMAP that was approved in an earlier coronavirus response bill, up to 6.2%, or an increase of 6.2%. We'd like to see that bumped up to at least 10%. And there are advocates all over the country calling for the same thing, because even those small incremental bumps in the FMAP translate into millions, billions of dollars at the state level, depending on where we're talking. We also would like to see a 100% FMAP match for all uninsured individuals, regardless of their immigration status, because right now, states like ours that haven't expanded Medicaid are having a disproportionately negative impact when it comes to how much our state is having to cover the cost of Medicaid. And also, we know that that is likely just going to get worse over time. Right now, it's looking like some states might open up early, right? And if that were to happen, then we can expect to see even more coronavirus diagnoses and deaths. And we want to make sure that the uninsured are not avoiding going to get treatment because they can't pay for it. And this would allow our state to be able to absorb that cost. We also want to see that increase in the FMAP extended beyond the public health emergency, so that we can really take in that increased demand for services during the economic recovery as well. Next. Speaking of how the most vulnerable are especially impacted by those things, we have a couple of requests that we want to include in our letter that are specifically focused on equity, because we're seeing, as Matt already told you guys, that there are significant disparities by race when it comes to who is being diagnosed with coronavirus, who is also able to take off time from work is really different. We also know that who is able to have a job right now that they can work from home changes based often on race, on immigration status, on all of these things that we know are tied to really big structural issues that we have going on in our country and our state that are going to need to be addressed if we're ever going to see no disparities in our outcomes. That being said, the only way to get better at addressing those disparities will be to collect and publicize demographic data to track that disparate impact and then target resource allocation to the places where we know people need it most. We know that right now, the folks who are being hit hardest by the COVID-19 pandemic are also those who are more likely to work critical frontline jobs that expose them to the virus, less likely to have health insurance, less likely to have paid leave, more likely to lose their jobs and their homes as a result of the crisis. And any future funding to help relieve the effects of the pandemic, we want to see go to the places where we know people are having to deal with all of those problems at once. We also have included the 2020 census extension here under this sort of moniker of equity, because it does change how communities are represented at the federal level. If you do not fill out a census form or don't receive a census form for whatever reason, or have trouble completing it and your needs aren't met in that way to be able to fill it out, what we know is that those communities will literally not be counted. The Census Bureau will try to approximate who lives in different areas, but your needs over the next decade aren't taken into account if the federal government doesn't have any idea that your community lives there, right? So very big equity issue. We want to see that extension to at least October 31st for self-response to allow time for advocates in the Census Bureau to put out some more promotion and get people to fill out the census more on their own, and also for the Census Bureau to kind of figure out a new field strategy for reaching folks in their homes in places where they know it's really difficult for them to fill out the form in other ways. Next slide. So economic security. We, along with lots of other advocates at the national level, want to see an increase in the maximum SNAP benefit by 15%, so that all enrolled families can see this benefit increase. And so, as Matt said, there has been an increase to the maximum benefit in the state, but right now, people who are already receiving the maximum SNAP benefit before coronavirus, which is also the people who had the lowest incomes and needed the that aid the most, they weren't eligible for that increase, right? And so we want to see an additional increase that would apply to them as well, so that everyone can have greater access to food supports during this really tough time. We would also like to see an increase in the minimum SNAP benefit, because they just can be very little additional money to help families, from $16 to $30. Next slide. And then in child welfare, we're looking for at least $1 billion to go toward prevention and response to a rise in child abuse and neglect that we know is on the way, and is going to be stemming from COVID-related stress on caretakers. We've seen this when other economic downturns happen, that the things trend together, that child maltreatment is really tightly linked to parental stressors, and also a lack of interaction with mandated reporters right now. So teachers, pediatricians, all of that, because kids are staying home, has already resulted in a decrease in reports of child maltreatment. And we really want to see more funding to try and prevent this and get families help that they might need to mitigate stressors, but also to respond to child maltreatment that becomes apparent once we are able to go back out into the world, right? And so this funding would include support for child welfare programs like community-based child abuse prevention grants, so CDCAP, Title IV foster care, and also Title IV-B prevention programs for child and family services. Next slide. And then in early education, we have a couple of asks, one of them rather big. The first is hazard pay and protective equipment for frontline workers, and to be sure that childcare providers are included among that designation, or within that designation of frontline workers. Right now, childcare providers and also folks who are working in child protective services have been left out largely from those designations, and so they haven't been eligible for additional funding for things like, more protective equipment as it becomes available, hazard pay if that were to become available. We want to make sure that they stay on the table, and that at the federal level, that lawmakers are seeing our childcare workers as integral to our coronavirus response and as frontline workers. And then also we'd like to see $50 billion go directly to the childcare sector, just to keep them afloat through this period. So this will stabilize the childcare system, this will keep providers in business, and it'll also help to ensure that parents are able to go back to work whenever it's safe for us to do that again. I think that is our final slide in terms of our priorities, but we'd really like to hear your thoughts about the things that we have kind of put at the top of our list right now. Are we leaving out something that's really important to you, to your family, to your work? Do you have any questions about the priorities that we have identified? Should we be focused on something else that we haven't let come to the top? We'd love to hear back from you before we send this off to the federal level. And that's it from me.
Thanks so much, Whitney, for that comprehensive overview. There's a lot of moving parts. It's huge. I mean, it's not funny, but it almost is, where in the last point you're like, and we need $50 billion for childcare.
Casual amount.
But there's just so many pressing issues at not only the state levels we're about to talk to, but the federal level as well. And we really do need to try to do our best to advocate with our federal lawmakers and get our organizations to do that, and let them know that these are pressing needs for North Carolina, because all of this stuff is coming together at lightning speed as far as federal legislation goes. So thanks a lot. Fawn, I know I wanted to, let you talk for a few minutes now to kind of frame up what's, kind of going on big picture at the state level and some of the needs at the state level as we're seeing it from NC Child. And then Ashley is going to go into more detail about some of the work that the legislature has been doing.
Great, thanks, Adam. And I see questions are coming in the chat and ideas for that federal letter. Please keep those coming in. We're going to circle back to questions as we get through the agenda here. So yeah, as Adam said, I'm just going to kind of make sure that everybody's kind of got the big picture here on what's happening with the state legislature, and then Ashley's going to talk more about some of the specifics that they're considering. But y'all have probably deduced a lot of this from what Matt said and other things. But anyway, as y'all know, the House has really been busy meeting in their working groups on COVID-19 recovery. And the big picture, the House has been very responsive, very proactive, very bipartisan in really rising to the challenge with COVID-19. These 4 work groups have received hundreds, maybe thousands at this point of public comments, and legislators have confirmed for us they're reading these public comments every week. So for all of you who have submitted comments to those work groups, thank you. You really are making a difference. Keep it coming. So that's really the House. The Senate, on the other hand, is kind of a big question mark, really. But what we know about the legislative calendar that we're looking at for 2020, those House work groups are going to continue meeting next week. Then on April 28th, the legislative session will officially begin. The House is planning for a very short session. They're talking about just 3 days. So on April 28th, they'll be filing bills electronically based on the work that those work groups have done. On April 29th, House committees will meet. It sounds like their standing committees, health, education, commerce, for example, they would be holding virtual meetings by Zoom to consider these bills. And by the close of that day, it sounds like they will roll all these bills together into one or more sort of big omnibus packages. And Ashley will probably have more information about that or correct anything I'm saying that has changed since yesterday. But then on the 3rd day of that session, April 30th, House members are going to come back to Raleigh to vote on that omnibus package. And that's going to be in person, but very carefully controlled so that they can maintain social distancing. And to do that, it's going to have to be, really tightly scripted and, coming in one at a time and really just voting up or down on 1 or 2 packages. And another reason for that is that they really do want to send a package to the Senate that the Senate will actually consider and not dismiss out of hand because there are controversial items included, as Matt alluded to. So what you should expect to see are really just items that are absolutely essential in order to draw down federal funding and respond in this crisis situation. Once that 3-day session ends, the House, from what we're hearing, is planning to recess for several weeks to really give that revenue picture time to firm up. And if anybody saw any of the revenue projections that the state legislature has gotten, those are just like a red line going down, down, down. So they're talking about coming back in June to do budget work, to do a budget or maybe mini budgets to fund specific items like what we saw last fall. But we're expecting to see some kind of budget coming from the House, by July. Again, I think that Senate is really more of just a question mark. We're hearing they may come into session in May. They may do a budget this year. They may not. We've heard a lot of different things, but the bottom line is that what we're seeing from the Senate is not what we're seeing in the House, that proactive emergency response kind of work. And the problem with that is you can't pass a bill or a budget without the House and the Senate, and of course the governor's signature. So, that's kind of the really big picture on legislative work, but I want to kick it over to Ashley to talk more about that House Health Work Group and some of the things that they're putting together for this session.
Great. Thank you so much, Fawn. Thank you, everybody. A lot has transpired since we were last together with these working groups. And as Fawn mentioned and really gave a good outline of, we're starting to get a clearer picture of what the short session may look like, especially from the House side. So the working groups that we've talked about, of course, the state operations working group, the working group on economic support, the working group on education, and the working group on health, they have all been meeting over the last few weeks. They are in the process of wrapping up the phase of their meetings focused on presentations. And we're starting to see draft legislation emerge from some of these work groups. Now, the work group that we have been primarily focused on is the health working group. And this week, the health working group met twice. On Tuesday, the working group met and heard a series of presentations on everything from concerns for rural health care in our rural hospitals, also on telepsychiatry. Deputy Secretary Cody Kinsley presented and talked about some of the behavioral health concerns and concerns with the intellectual and developmental disabilities populations. So good discussion on a lot of different topics. On Tuesday, there was also a presentation by the pharmacists group and some of their concerns. So then what we saw yesterday in the health working group was the emergence of a new document. And this is a document that if we can send the link out, it would be great. If not, you can easily access this document by going to the General Assembly website. Again, that House Select Committee on COVID-19, go to the documents section and then click on the health working group for the meeting from yesterday. And I will not even begin to mention what date it was because my dates are running together, but that was yesterday, Thursday, today's Friday. So this document outlines the list of policy concerns that have really risen to the top for the health working group's consideration. And we were really excited on behalf of NC Child to see 4 of our recommendations that were outlined in the letter that was sent to the chairs of the House Health Working Group and some of the other chairs from the other working groups, as well as the speaker. But NC Child's recommendations are outlined in this document found on page 1, NC Child's recommendation regarding our aggressive work of trying to seek waivers and flexibilities in the foster care system and encouraging DHHS to seek those opportunities. Then when you move to page, I believe it's page 9 of the document, and it's a chart document, NC Child is listed as one of the main requesters of Medicaid Expansion, along with the American Cancer Society, NCHA, DHHS. On page 12 of the document, we've got 2 requests that are included again in this funding options policy paper that the health working group is considering. The request to appropriate funds to Feeding the Carolinas and the state farmers markets to ensure food banks can meet increased need of $6 million. And then line item row 52, NC Child is listed as the requester for child care emergency economic support, again at the level, and this amount increased since the letter that we sent out because of just looking at the numbers and the need of $183 million. And so we were excited to see those requests included in this policy option document. Obviously, continued advocacy needs to take place, outreach to legislators. They are one of the things that was clear in the health working group discussion yesterday. I think they are going to be looking at every available federal dollar that will be coming down. And so to really make the case for the additional state funds that are needed, that has to be clearly articulated and advocated. And so that's what we will be working on in our continued discussions and meetings between now and when those recommendations are made available. So to summarize very briefly on this, the policy options document was put forward yesterday during the meeting. The Representative Lambeth mentioned that the House Select Committee health working group will meet again next week, and they anticipate having 2 draft bills available. One will be a policy bill and one will be a funding bill. And so we are working to hopefully have some of these recommendations included in that draft bill. And then those bills will go to be considered, as Fawn mentioned, when the legislature convenes for its short session at the end of this month. A couple very brief other mentions. If you're interested in the draft legislation from the other working groups, I know there was a big education omnibus draft bill that was put forward yesterday in the education working group meeting. There's been several bills related to unemployment and trying to ease the burdens and regulations of individuals seeking unemployment compensation. And then also in the economic support working group, there was suggested legislation put forward to include another $25 million to Golden Leaf Foundation for those small business loans. So pretty dynamic time. Again, this is primarily what we're seeing on the House side, and some question marks about looking at what the Senate might do. Hopefully we will likely be hearing from the Senate very soon on those plans. And they are in the process of trying to figure out how to have those in-person votes. Again, the logistics of making sure they're practicing the social distancing, but being there in person when they are at the point of voting on legislation. They can hold the meetings and committee discussions on via teleconference, but the voting has to take place in person.
Thanks so much, Ashley. As always, we really appreciate you staying on top of many things that are moving right now. And yeah, we certainly, will all keep advocating as this process moves forward at the end of the month. And it is going to be a session, albeit if it's just a one-day session like no other, because this whole idea of having to space people out physically and hold votes and do things is going to be interesting. We'll just hope that everybody stays healthy through that process. Okay, so we've given a pretty comprehensive view from the administrative side of things with DHHS, the federal side of things, and things that are emerging in the next stimulus package at the state level, kind of a bigger picture from Fawn, thinking about, okay, what's going on in the House, what's going on in the Senate, how might this budget process play out, and then, of course, a lot of the specifics that Ashley just went through. I think the last thing we definitely wanted to do on this call is engage you all who are tuning in and get your thoughts here, via chat. And then, of course, after this video call, feel free to contact us as well. We want to know, are there things that we could do to improve these updates? Are there other topics or things that you would love to hear more about? And also, what are the other things you are hearing about at the local level, the pressing issues sort of in the day-to-day? We definitely are going to be trying to incorporate even more of a local perspective moving forward with these, perhaps having a local speaker featured, for example, on each of the calls to say, hey, in Halifax County, here's what we see going on. In Mecklenburg County, here's what we see going on, et cetera, because I think that those are extremely helpful. That's where we get the best information. For example, I know one thing we've been hearing a ton about here at NC Child is issues just around unemployment and, getting unemployment insurance and people having questions about that process and making that happen because unfortunately we're seeing historic numbers of people having to file for unemployment. So, if there's just things related to children and families that you are noticing on the local level, please let us know and let us know how to incorporate them into these calls. So Fawn, I was just thinking maybe we would give it a minute to for people to respond if you would like to in the chat box. And then, I also want to encourage everyone, as we move forward on the advocacy front, with the federal asks that were laid out by Whitney, state level type work that we're doing too. We want your all's help and to keep everyone involved as we push those forward. So we will keep promoting actions that people can take.
Absolutely, Adam. Thanks for sharing that, and seeing some great feedback coming into the chat box. Again, you know, our two questions for you really are, one, how can we make these updates better for you? And what do you need us to cover? And we want to get your questions now in the chat box or anytime by email. You can always respond to just hit reply to any of the emails we send out, and we'll get that. And then the other thing is really, what are the biggest problems that kids and families are facing in your community with regards to COVID-19? And we really want to hear that and make sure that what you all are facing is informing, you know, the advocacy information that we're sharing with all of you. The last thing I'm going to do is go ahead and share our last slide. That's just the COVID-19 link to our webpage and the sorry, I'm trying to talk and do this at the same time, and that never works for me. But anyway, Ashley was mentioning the legislative working group documents, and you can find all of those on this website, all the updates that we're providing. The recording of today's call will also be up on this website a little bit later today, and we do those both in English and in Spanish. So we'll send you out an email to let you know when it's up there, but by about 5 o'clock today, both of those updates will be there. And you can share those with others in your community if that's helpful. So just want to say thanks to everybody for all the input you've been giving. I think Ashley's update really underscored how important your input is in influencing our state legislature and influencing what our decision makers are doing. So thanks for that. And I'm going to go back on mute and let you all answer, you know, share more of your thoughts in that chat box.
Well, and I think a theme that I'm seeing, you know, is you know, mental health support for children and families that, you know, let's be honest, there's a lot of holes in the system prior to COVID-19, and now that's been blown wide open even more. And so, you know, that just seems to be a priority that we hear about time and time again. And maybe there's a way that in the very near future on a call, we can really kind of feature discussion around mental health services and needs, both, you know, from a programmatic standpoint and also from a policy standpoint. I mean, I think that also fits into youth suicide prevention. What are we doing to support school professionals like school psychologists and school nurses? Of course, issues around telehealth, et cetera, with child psychiatry. Again, another huge area that lots of work needs to be done.
Sorry, I also saw mention of concerns about housing. Mm-hmm. And I don't know, it was a little further up the Zoom chat, but I'm wondering if folks are hearing from any other groups about what specifically we'd like to see. Is it, you know, nationwide moratorium on rent? Is it, you know, I'm not sure, because it's not an area that we work in very often. I've only seen about one national group that had some concrete steps that they would like to take in terms of housing. And so I'm wondering at the local level if there are things you guys are hearing that would be particularly useful. And if not, that's fine. I mean, I can look into it with other national advocates, but that's a really good point too that I want to make sure doesn't fall off the table. Mm-hmm. No evictions. Okay.
Yeah, again, that's another topic that could be great as a feature topic for us to talk more about and get others, maybe somebody else on the call also that you have some in-depth knowledge of what's happened so far in the response and what needs to happen, et cetera.
Thank you guys for your input. I see some comments about McKinney-Vento and children experiencing homelessness too. I appreciate that. That is a good catch. Mm-hmm.
Well, certainly keep those ideas coming. We're gonna, you know, certainly tabulate what's being said on the chat box and let us know. And you'll start seeing this information reflected in our updates coming up. So next week we will be it'll be right before the special legislative session. So I imagine we'll have even more updates, especially on the state level, about legislation that has been drafted and formed up, at least on the House side. So that will probably be a big part of what we're talking about. I think we're also going to be talking more about child welfare next week, if I'm not mistaken. And then, after that, the week after that will be post that legislative session. So we will be able to kind of update everyone on what happened when the legislators came back to Raleigh. Okay, so thank you everyone for your participation. Hope you have a wonderful day and wonderful weekend, and we will talk to you next week.